Infection control is the responsibility of every employee in the assisted living facility, from the caregiver to the cook to the driver to the administrator. Meeting the responsibility of successful infection control protects both the resident and the employee from potentially life-threatening infectious diseases. In this video, we will introduce basic infection control concepts, including transmission and prevention. Standard precautions to prevent spread of bloodborne diseases will also be discussed. For an infection to occur, a series of events, known as the chain of infection, must take place. The chain begins with the infectious organism and its transmission, and finishes at the susceptible host. Preventing the spread of infectious diseases focuses on breaking this chain.
When we talk about the chain of infection, we're referring to a series of events or steps that must take place in order for an infection to occur. The chain of infection begins with the infectious agent, or the microorganism, or put more simply, the germ that is causing the disease. However, in order for that germ to become strong enough and abundant enough to cause an illness, it must have a reservoir, or a place to grow. In the assisted living facility, a reservoir could be anything from a dirty towel hanging in a bathroom, a piece of soiled linens or laundry, contaminated food that was not stored properly, or of course the human body. The human body makes a terrific reservoir for germs to grow. The human body is warm, full of nutrients, full of moisture, and many parts of it are full of oxygen, all of those things that are needed for most germs to grow and survive. Once the germ becomes abundant enough in its reservoir, it then needs a portal of exit, a way to get out of that reservoir. The portal of exit could be through direct contact, or of course in the case of a human body, the portal of exit could be through the mouth, the nose, in feces, in urine, of course as we breathe, or even through our skin. Once it gets out of the reservoir, the germ must go through a mode of transmission, a way to get from the reservoir eventually to the host. And we'll talk more about those modes of transmission in just a little bit. The germ then also needs a portal of entry, a way to get in. And you can simply remember that anything that can function as a portal of exit on the human body can function as a portal of entry. So again, the mucous membranes of the mouth, inside the nose, or inside our eyelids, our urinary tract, our gastrointestinal tract, for example, if we eat something that has been contaminated. The skin also can act as a portal of entry if it's broken. When intact, your skin is actually a wonderful defense mechanism. But if it's broken through a cut or through a wound, then germs can very easily, of course, get into the body. The last step in the chain of infection is, of course, the susceptible host. In this case, this is the person that comes in contact with this infectious agent or this germ. And all of the conditions are right in order for that germ to get into their body, survive, multiply, and begin to cause disease. As an employee in the assisted living facility, our focus is to try and break this chain of infection. If we can stop just one step along that chain, we can prevent disease. An infectious agent is a microorganism or a germ that can cause disease. While there are many germs we constantly encounter in our environment, a relatively small number of them can actually cause disease in human beings. Those that are of particular concern would include bacteria, viruses, fungi, and parasites. Bacteria include things like Staphylococcus, Streptococcus, germs you've probably heard of before like E. coli that of course can cause very serious gastrointestinal illnesses. Bacteria are one of the most common germs in our environment, and they are very common causes of things like skin infections. Viruses would include the human immunodeficiency virus, or HIV, the cause of AIDS. It includes hepatitis viruses like hepatitis B and hepatitis C. Fungi would include things like the cause of ringworm, a fungal infection of the skin. Fungi thrive in warm and moist environments.
Microorganisms can be transmitted through a variety of routes. In the assisted living facility, precautions to prevent transmission through these routes must be implemented.
Once the germ multiplies and becomes strong enough in its reservoir, it then needs a mode of transmission to get from the reservoir to the next susceptible host. These modes of transmission can be put into 4 general categories: contact, airborne transmission, vehicle transmission, and vector transmission. Contact is one of the most common routes of transmission in the assisted living facility. It can occur through things like direct contact, one person touching another person. For example, if I had some bacteria on my skin and I touched someone's wound with my bare hands, it could cause an infection of that wound. Contact also can occur through indirect contact. In this case, transmission goes from the infected person to an inanimate object and then to the susceptible host. For example, if I clean my hands with a towel and then leave that hanging in the bathroom, another person comes in behind me and washes their face with that towel, they could acquire an infection from the bacteria I left on the towel. Indirect contact could also occur through things like needle stick injuries. If a syringe or a needle and syringe are not properly disposed of into a sharps container and someone was to stick themselves with that needle, they could come into contact with another person's blood through this indirect transmission. Probably one of the most notorious examples of airborne transmission would be tuberculosis. However, other very common illnesses like colds and flus can be spread through airborne transmission. Each time we breathe air out of our lungs, very small microscopic droplets of moisture come out of our lungs into the air around us. On those droplets of moisture can be these small microscopic germs or bacteria being carried out of our lungs. If another person then breathes in those germs in the air, they can become infected through airborne transmission. Vehicle transmission again refers to an inanimate object such as a towel or a countertop or a sink faucet carrying a germ. Again, it is closely involved in indirect transmission, as we described a second ago. The last one, vector transmission, refers to germs being carried and spread to a person by a bug or an animal. Of course, we know that insects like ticks and mosquitoes can carry diseases like Lyme disease or malaria, respectively. Fortunately, many infectious diseases that we're aware of, such as HIV, cannot be carried by insects or animals to humans. The key to preventing the transmission of infectious diseases in the assisted living facility, again, goes back to breaking that chain of infection. And one of the first things we can do to break that chain is to minimize the agents in the environment and to minimize the buildup of reservoirs in the environment. We can do this primarily through simple cleaning and disinfection. It is such a basic, simple process we do every day in the facility, but if not followed carefully and consistently, it can again contribute to the spread of disease. Some things to remember about cleaning and disinfection. First of all, you must clean before you can disinfect. In other words, if there is some material, such as some blood on a countertop, before you can disinfect that countertop, you first must clean up all the visible blood. Secondly, whenever we are cleaning or disinfecting in the facility, we should be covering our hands with latex gloves. When you begin with cleaning, remember to first rinse the area or the object with cold water. If you rinse with hot water first, you actually can encourage that material to adhere to the surface. So remember, first rinse with cold water. Then, with your gloved hands, wash the area down with just simple soap and warm water and paper towels. Once you have removed all of the visible material, in this case, visible blood on the countertop, you then want to go back and give the area a final rinse with warm water. If necessary, you can use a stiff bristle brush to remove the material from any cracks or seams on the object or on the surface. Now that you've cleaned the area, you're ready to disinfect. It's important to remember to use an appropriate disinfectant. The CDC recommends a combination of bleach and water. A mixture of 1/4 cup bleach added to 1 gallon of water is a very effective disinfectant. Remember to make this each day, as over time it degrades and becomes less effective. After you've cleaned the area, spray it down with your disinfectant, your bleach and water, and allow it to sit for a little while. It needs time to work. Finally, with your gloved hands, wipe down the area with some new paper towels and discard them. After you're done, remove your gloves and wash your hands. The final thing to remember about breaking the chain of infection is to help protect our residents and ourselves from becoming susceptible hosts. While it's true that there are some infectious diseases that, regardless of how healthy your body is, can cause illness, there are some things you can do to help minimize your risk and minimize the risk to your residents. First, simple regular bathing to help remove germs from the surface of the skin. Regular oral hygiene to protect the teeth, the gums, and the mouth. Adequate fluid intake. Make sure your residents drink enough water or fluids each day. Persons with respiratory conditions such as emphysema or COPD may need to implement daily deep breathing and coughing exercises to help keep the lower airways clear of mucus. Finally, things like a well-balanced diet, plenty of sleep, and measures to reduce stress also help to keep the body healthy and maintain the healing process. It's also important that under your facility policies and under appropriate physician orders, staff members and residents in the facility receive the appropriate vaccinations that are available. This would include things like the influenza or flu vaccine every year, and for some persons, the pneumococcal vaccine.
Initially developed in 1987 by the Centers for Disease Control, universal precautions were issued to prevent the transmission of bloodborne diseases such as AIDS and hepatitis B. In 1996, the CDC published new guidelines called Standard Precautions that summarize features of various precaution methods, including universal precautions. When properly followed, standard precautions can help to prevent the transmission of HIV, hepatitis, and other bloodborne pathogens.
The CDC developed standard precautions to reduce the risk of transmission of bloodborne diseases. This would include things like HIV, hepatitis B and hepatitis C, syphilis, and many other life-threatening bloodborne pathogens. The key components to standard precautions include the use of personal protective equipment, such as gloves, gowns, and masks as appropriate. Hand washing. Hand washing is the most important piece of standard precautions. The proper disposal and handling of sharps, such as needles and syringes or perhaps contaminated broken glass. And finally, environmental controls such as proper cleaning and disinfection to minimize the risk of transmission from the environment. The most important thing to remember about standard precautions is that they apply to everyone. Every resident and every employee in the facility should be handled using standard precautions. We never want to assume that a person is safe. In other words, put more simply, when following standard precautions, we actually assume that everyone may be carrying some sort of bloodborne disease. The single most important and effective thing you can do as an employee in the facility to prevent infections is to wash your hands. Washing your hands not only protects your resident, but it protects yourself from anything you may come in contact with in the environment. When washing your hands, some things to remember. First of all, you must wash long enough. The CDC generally recommends 10 to 15 seconds at least when washing your hands. Secondly, when washing hands, it's not just the soap and warm water, but it's the friction as you vigorously scrub your hands back and forth that kills and removes the germs that are on your skin. The first rule of thumb is, when in doubt, wash your hands. It's really difficult to say you could ever do it too often in the facility. However, some times when you want to be sure you've properly washed your hands include after caring for any resident that has an infection, after touching any organic material, before performing any invasive procedure if that's appropriate under your job description, before and after handling dressings or touching wounds, such as before and after first aid, after handling contaminated equipment, before coming in contact with clients who are susceptible to infection, such as persons with a compromised immune system, before preparing or eating food, after handling blood or body fluids, and after any personal contact that may contaminate your hands, such as after